The Medical Center of Elberton is again appealing a state decision to suspend their COVID-19 vaccine shipments, hoping a Fox 5 I-Team investigation proves the rules were confusing for who should be vaccinated.
Yeah, that facility got in trouble for vaccinating teachers. Now, on Wednesday, the Floyd Medical Center confirmed that it also vaccinated hundreds of people outside the approved priority guidelines. But the state tells Fox 5 I-Team reporter Randy Travis the two are not the same.
And you come in here without a court order, without any documentation.
The decision last month was unprecedented. Georgia's Department of Public Health seizing COVID vaccines from the Medical Center of Elberton after the family practice clinic confirmed it had vaccinated 177 teachers, even though they weren't part of the current priority group.
We were told 20 minutes ago that you would be arriving in 20 minutes, which was 10. It's not a voluntary pickup.
There was never any malicious intent, and I think our citizens in our county appreciate that. We were trying to protect everybody as best we could.
But DPH was unmoved. Sending a message, the state suspended all future vaccine deliveries to the rural medical facility for the next 6 months. But as it turns out, Elberton was not the only one coloring outside the vaccine lines.
We need our staff to be able to care for our patients.
Floyd Medical Center in Rome offered vaccines to all family members of employees, even if they were not a caregiver or at least 65 years old. 2 groups currently approved for shots. The idea was to make sure staff would miss shifts to care for a COVID-stricken relative. 766 family members have been vaccinated. But the state doesn't seem likely to level the same stiff penalties as it did for Elberton.
Why isn't the situation in Floyd County similar to the situation in Elbert County?
They made a decision that they thought was in the best interest of their hospital system to keep their employees working.
But he says no decision on punishment has been made.
What is your opinion of what Floyd Medical Center did?
Well, I'm sympathetic to them. I think it does point to the fact there's confusion within these guidelines and what we are supposed to do with these vaccines.
Dr. Jonathan Poon's Medical Center made sure they were ready to serve their community of 20,000 people, last fall buying a $7,000 ultra-cold freezer to meet the vaccine requirements. They would be one of the first private clinics in Georgia to get the vaccine. All medical workers were vaccinated in December, so without notifying the State Department of Public Health, Elberton reviewed the current state vaccine policy online and decided it allowed them to move into the next phase. Teachers and senior citizens.
If the argument was that we were not supposed to move into the next phase, the logical question was we should have stopped in mid-December and not vaccinated anybody until January 11th.
January 11th is when the state allowed vaccinations to begin for 65 and older. Teachers are still not in the approved vaccine group. The state dismissed Elberton's explanation and took away their vaccine.
So these are going to Athens, Clark County.
Floyd Medical also did not get permission from the state to vaccinate employees' families, although it did notify the regional DPH office in Rome of its plans. Floyd was considered a closed pod, meaning it was not expected to use its vaccine supply outside the hospital. Both Floyd and Elberton are still issuing second shots to those unauthorized patients. But after that, one will be out of the vaccine business for a while. The other likely will not.
May I ask you how many doses you took exactly?
We're not trying to scapegoat any other hospital systems. I think we are all trying to do the right thing, and DPH has become a hindrance in that with these investigations.
They've mailed off another appeal, waiting to see whether the actions of another medical center could affect the future of theirs. Randy Travis, Fox 5 News.